The Anambra State government recently launched the Anambra State Laboratory Optimization Project in conjunction with Bloom Public Health. Now, what is this project all about? Have you ever been to a hospital and probably you were sick, you needed diagnosis, and they referred you to a lab, and it took quite some time for the lab to come out? While it was taking time, you were getting sicker and sicker and sicker. Has it ever happened to you? Now, this project intends to make it easier for the people of Anambra State to have access, especially the common man, to have access to affordable laboratory services. Now, the launch of this project brought together partners that will work to ensure that people have easy access to laboratory services, they have easy access to health services, they have easy access to doctors, and they will be making use of telemedicine such that when a patient comes to the hospital or to the primary health center, there will be a doctor. From what we were told at the launch, the Anambra State government already is implementing telemedicine, a situation where when a patient goes to primary health care center, they are attended to. There will be a doctor that will attend to them over the phone without necessarily seeing a doctor physically. And now that's an advancement. Of course, Professor Ayakoro had this to say when he was talking about the project.
Equipment manufacturers, public health professionals, state governments, the regulators to work together. How do we make sure that we can make these labs available? So eventually, as you see, in what the state is trying for this, the first thing of charging for this will be very, very low comparatively. And the equipment there will be working in 4 hours. If anyone cannot be repaired, it's pulled out and replaced. So it's a kind of innovation in the center. So back to your question. Once the state governments have labs that are working, it's easier for them to pull everything up. So that's the question. At least one of government is working well. The people here have been trained, and the training will continue. Both technical training, medical training, and any other training required for this work. Everybody, equipment manufacturer, has a huge online resource of training and training. So beyond what we do physically, to keep happening, any new technique, any new testing that is available, any whatever possible thing that to improve the lab system, we do that. Also, what we call a quality management system. That we're going to be placed to the labs. Even though not all the labs that will get what is called ISO 15189, but we'll make sure that we move them close to that level. And if possible, we need to support that once we have only one lab number state, we have 15189. So that's our plan.
The state government has just launched an Anambra State Laboratory Optimization Project.
Yes.
Tell us about this project. What is the essence? What is it all about?
Actually, this project is beautiful because it's like, we already have our general hospitals, we have good labs, but for the primary health care facilities, we want to see how we can optimize services using this hub and scoop model, whereby Bloom, WHO, and other partners have tried to organize this very sophisticated but basic machines in some of the general hospitals that will service the PSCs. So like we have now one in General Hospital below Agolo, for instance, which will service all the PSCs around Agolo. So that because of what governor has done, he has been able to equip each one PSC per ward. So they all have doctors as well, 2 doctors per local government, using telemedicine, sophisticated technology. Every patient, even if you're in the remotest area, can have access to a medical doctor. So if the medical doctor sees it real time, he's looking at you, see you, and the nurse is examining you. So once the doctor finishes, there's need for any lab examination, quickly they can use this means, this other to get that person examined, get the diagnosis, and be able to take a diagnosis.
Please, I'd like to ask.
Yes.
I hope it will be affordable.
Very affordable, yes, because you can see the people that are coming in to do this. They're not looking at the profit per se service that we're looking at. So they've done it in different countries and we want to see how it works here. So these are the 5 pilots local governments we're starting with. Once it goes the way we want to escalate.
Wait, I want to understand on the clear. I'm saying this laboratory project, where will it be domiciled?
In the general hospitals. We have in Agro General Hospital, we have in just 5 local governments, we have at Tomo is there, we have at Onitsha, but in Onitsha we're using one of the biggest pieces because there's no general hospital for now. That's in Onitsha now. Then 2 other, no, general hospital. So in those hospitals, they are the hub. Then the spokes, the other PSCs will now be using that service.
Okay.
So it becomes affordable to the people in the grassroots.
Okay.
One last question from me. What about the time? I hope it will be real-time results.
Yes, real time. Okay. They have every structure on the ground to make it real time. And then they're able to send the data as well to them. Even if there are some labs that will not come out the same day. So it depends on the nature of the lab.
Okay.
Yes, but what we're sure of is that it will be real time. It's all what the governor is doing in the state. I mean, what else? We have internet in all the facilities. So you can always send
What problem will this address?
laboratory having good diagnosis.
Good diagnosis.
Yes.
Thank you.
That's all.
Of course, with the launch, it is expected that the workers that were trained by the Bloom Public Health and Anambra State government will ensure that the people of the state have easy access to laboratory services. Don't forget to subscribe to my channel. I am Chivik TV and see you in my next video. Do stay good.